Hello everyone, and welcome back to the channel. Today we're diving into a topic that so many of you have asked about, one that can feel a bit overwhelming but is incredibly important: Medicare. Specifically, we're going to break down the big question: should you choose an Advantage plan or stick with original Medicare? Making the right choice can significantly impact your healthcare and your wallet, so let's clear up the confusion together. First, let's understand the foundation: original Medicare. Think of this as the government's core health insurance program for seniors and certain younger people with disabilities. It's made up of two parts. Part A is your hospital insurance. It helps cover inpatient hospital care, skilled nursing facility care, hospice and home health care. For most people who've worked and paid Medicare taxes for at least 10 years, Part A is premium-free. Then you have Part B, which is your medical insurance. This covers things like doctor's visits, outpatient care, medical supplies, and preventive services. Unlike Part A, Part B has a monthly premium that most people pay. In 2024, the standard premium is $174.70, but it can be higher depending on your income. So, with original Medicare, you have Part A for the hospital and Part B for your doctor. Simple enough, right? But here's the crucial part about original Medicare: it doesn't cover everything. It typically pays for about 80% of your approved medical costs. That remaining 20% is your responsibility, and there's no yearly limit on how much that 20% could be. Imagine a major surgery or a serious illness. That 20% could quickly add up to tens of thousands of dollars. This is what we call a coverage gap. This is also why many people with original Medicare don't stop there. To help cover that 20% gap and other out-of-pocket costs, they often purchase a separate policy called a Medicare Supplement Insurance Plan, also known as Medigap. These plans are sold by private insurance companies and are designed to fill the gaps in original Medicare. There are several standardized Medigap plans, each offering a different level of coverage, but they all work alongside your Part A and Part B. Another thing to remember is that original Medicare does not include prescription drug coverage. To get that, you need to enroll in a separate standalone Medicare Part D plan. So a common setup for someone on original Medicare is Part A, Part B, a Medigap plan for the 20% gap, and a Part D plan for prescriptions. This combination gives you very comprehensive coverage and the freedom to see any doctor or visit any hospital in the US that accepts Medicare without needing a referral to see a specialist. That freedom is a huge benefit for many people. Now, let's switch gears and talk about the other path you can take: Medicare Advantage, also known as Part C. This is an alternative way to get your Medicare benefits. These plans are offered by private insurance companies that are approved by Medicare. When you join a Medicare Advantage plan, you're still in the Medicare program, but the private company manages your Part A and Part B benefits. Think of it as an all-in-one bundle. Most Medicare Advantage plans include everything original Medicare covers, and they often roll in prescription drug coverage, Part D, as well. So instead of having 3 or 4 separate cards for Part A, B, Medigap, and D, you just have one card from your Advantage plan provider. That simplicity is very appealing. One of the biggest draws of Medicare Advantage plans is the cost structure. Many of these plans have very low or even zero monthly premiums. You still have to pay your Part B premium to the government, but the plan itself might not cost you anything extra per month. Instead of the 20% coinsurance you have with original Medicare, you'll typically pay smaller fixed amounts for services, like a $20 copay for a doctor's visit or a $250 copay for a hospital stay. Furthermore, Medicare Advantage plans are required to have a yearly out-of-pocket maximum. This is a safety net that original Medicare on its own doesn't have. Once you've spent a certain amount on copays and deductibles in a year, the plan pays 100% of your covered medical costs for the rest of the year. This provides a clear limit on your financial risk, which can be very reassuring. And the perks don't stop there. To compete for your business, many Advantage plans offer extra benefits that original Medicare doesn't cover at all. We're talking about routine dental, vision, and hearing coverage, gym memberships through programs like Silver Sneakers, allowances for over-the-counter items, and even transportation to medical appointments. These built-in extras can add a lot of value and convenience to your healthcare experience. So, with low premiums, an out-of-pocket maximum, and all these extra benefits, Medicare Advantage might sound like the obvious choice. But hold on, there are some very important trade-offs to consider. The biggest one is the network. Most Medicare Advantage plans operate with a network of doctors and hospitals similar to the HMOs or PPOs you might have had through an employer. This means you generally need to use doctors, specialists, and hospitals that are in your plan's network for your care to be covered. If you go out of network, your costs could be much higher or not covered at all except in an emergency. You may also need a referral from your primary care physician to see a specialist. This is a significant difference from original Medicare, which allows you to see virtually any doctor nationwide who accepts Medicare. If you travel a lot or have doctors you love who aren't in a particular plan's network, this could be a deal breaker. So let's put it all together. How do you decide? It really comes down to your personal priorities, your health, and your financial situation. Let's look at the profile of someone who might be a great fit for original Medicare paired with a Medigap plan. This person values freedom and choice above all else. They want to be able to see any doctor or specialist who accepts Medicare anywhere in the country without worrying about networks or referrals. Maybe they travel frequently to visit family or spend winters in a warmer state. They might also have chronic health conditions and want the predictability of knowing that after their Medigap premium, most of their medical bills will be covered at or near 100%. They are willing to pay a higher monthly premium for this peace of mind and flexibility. Their total monthly cost would be the Part B premium, the Medigap premium, and the Part D premium. While this is often the more expensive option month to month, it can lead to very low or even zero out-of-pocket costs when you actually need care. On the other hand, who is a good fit for a Medicare Advantage plan? This person is often more budget conscious. The appeal of a low or $0 monthly premium is very strong. They are generally healthy and don't expect to need a lot of medical services in the near future. They are comfortable with using a network of providers and don't mind getting a referral to see a specialist. They live in an area with a robust network of high-quality doctors and hospitals available in the plans they are considering. The all-in-one nature of the plan, with drug coverage and extra benefits like dental and vision included, simplifies their life and provides great value. The out-of-pocket maximum gives them a solid financial safety net, protecting them from catastrophic costs. There is no single best answer for everyone. What's perfect for your neighbor might be a terrible fit for you. My advice is to sit down and honestly assess your needs. Consider your health status. Do you have chronic conditions that require specialist care? Think about your finances. Are you more comfortable with higher monthly premiums and fewer surprise bills, or lower premiums and paying for services as you use them? And consider your lifestyle. Do you travel, or do you have specific doctors you absolutely want to keep? Before you make any decision, do your homework. Use the Medicare Plan Finder tool on Medicare. Gov. You can enter your zip code, your medications, and your preferred pharmacies to compare all the plans available in your area, both Advantage plans and Part D plans. Look at the plan ratings, the networks, and the total estimated yearly costs. This is a big decision, and you don't have to make it alone. Consider speaking with a licensed independent insurance agent who specializes in Medicare. They aren't tied to any one company and can help you compare all your options objectively based on your unique situation. Ultimately, whether you choose original Medicare with a supplement or a Medicare Advantage plan, the goal is to find the coverage that gives you access to the care you need with a financial structure you're comfortable with. I hope this breakdown has made the choice a little clearer and less intimidating. Thank you so much for tuning in today. If you found this video helpful, please give it a thumbs up. And don't forget to subscribe to the channel for more content to help you navigate your health and finances. If you have any questions, drop them in the comments below. Stay healthy, stay informed, and we'll see you in the next video.